The discovery of antibiotics revolutionized medicine. Diseases once considered death sentences became treatable. However, this victory was short-lived. Microbes, the microscopic organisms that cause these diseases, are incredibly adaptable. They evolve rapidly, developing ways to survive even in the presence of drugs designed to kill them. This phenomenon, known as antimicrobial resistance, has given rise to a new threat: superbugs. Superbugs are strains of bacteria, viruses, fungi, and parasites that have become resistant to multiple antimicrobial drugs. This resistance makes infections much harder and sometimes impossible to treat. The once easily treatable infections are becoming deadly again. We are on the cusp of a post-antibiotic era, where even minor injuries and common infections could become life-threatening. The rise of superbugs is a global health crisis. Each year, millions of people worldwide are affected by drug-resistant infections. Thousands die as a result of these untreatable infections. The threat of antimicrobial resistance extends beyond individual health. It has far-reaching economic and societal implications. The fight against superbugs is a race against time. As microbes evolve, we must develop new strategies to stay one step ahead. This involves a multi-pronged approach: developing new antibiotics, exploring alternative treatments, understanding the drivers of resistance, and promoting responsible use of antimicrobials. The discovery of penicillin in 1928 by Alexander Fleming marked a turning point in human history. This miracle drug ushered in a new era of medicine. Bacterial infections, once a leading cause of death, became treatable. Penicillin and subsequent antibiotics saved countless lives and transformed healthcare. However, the effectiveness of antibiotics was not to last. Even as early as the 1940s, scientists began observing the emergence of antibiotic resistance. Bacteria, with their rapid reproduction rates and ability to share genetic material, were quickly adapting to these new drugs. Over the decades, the overuse and misuse of antibiotics have exacerbated the problem. The widespread use of antibiotics in agriculture, particularly in livestock, has further fueled the development of resistance. Antibiotics are often used not to treat infections, but as growth promoters in livestock. This practice creates a breeding ground for drug-resistant bacteria, which can then spread to humans through consumption of contaminated food or contact with animals. The more we use antibiotics, the more we drive the evolution of resistance. This is a classic example of natural selection. When bacteria are exposed to antibiotics, the susceptible ones die off, while the resistant ones survive and multiply. Over time, this leads to the emergence of populations of bacteria that are highly resistant to multiple drugs. The rise of antibiotic resistance is a stark reminder that we are engaged in a constant arms race with microbes. To stay ahead of this threat, we must develop new antibiotics and explore alternative treatment strategies. We must also address the root causes of resistance, such as overuse and misuse of these life-saving drugs. The World Health Organization has identified antimicrobial resistance as one of the top 10 global health threats facing humanity. The numbers are alarming. Current estimates suggest that drug-resistant infections are directly responsible for over 1 million deaths annually. This number is projected to rise dramatically in the coming decades, potentially surpassing deaths from cancer by 2050. The impact of superbugs is felt worldwide, but some regions are disproportionately affected. Low and middle-income countries, particularly those in South Asia and Sub-Saharan Africa, bear a significant burden of drug-resistant infections. Limited access to healthcare, inadequate sanitation, and overuse of antibiotics in agriculture contribute to the high rates of antimicrobial resistance in these regions. The economic consequences of antimicrobial resistance are also staggering. Untreated infections lead to longer hospital stays, increased healthcare costs, and lost productivity. The global economy could lose trillions of dollars annually by 2050 if effective measures to combat antimicrobial resistance are not implemented. Beyond the devastating human and economic costs, antimicrobial resistance poses a threat to modern medicine. Many medical procedures, such as organ transplants, chemotherapy, and major surgeries, rely on the effectiveness of antibiotics to prevent infections. The rise of antimicrobial resistance threatens to undermine these advances in healthcare. The fight against superbugs is a continuous arms race. As microbes evolve, scientists are working tirelessly to develop new weapons in our arsenal to combat drug-resistant infections. This involves a two-pronged approach: developing new antibiotics and exploring alternative treatment strategies. Traditional antibiotic development has slowed in recent years, but there have been some promising breakthroughs. Researchers are exploring new classes of antibiotics with novel mechanisms of action. These new drugs target essential bacterial processes, such as cell wall synthesis or DNA replication, in ways that circumvent existing resistance mechanisms. In addition to developing new antibiotics, scientists are exploring alternative treatment strategies. These include phage therapy, using viruses that specifically target and kill bacteria, monoclonal antibodies, laboratory-made proteins that target specific parts of bacteria or viruses, and antimicrobial peptides, small proteins produced by the immune systems of many organisms, including humans, that have broad-spectrum antimicrobial activity. These alternative approaches offer hope for combating infections caused by multi-drug-resistant organisms. However, significant research and development are needed to translate these promising therapies into widely available treatments. Section 5. The Roots of Resistance: Understanding the Causes of AMR. To effectively combat antimicrobial resistance, it is crucial to understand the factors that drive its development. Two primary drivers contribute to the emergence and spread of AMR: genetic mutations and the misuse and overuse of antimicrobials. Bacteria, like all living organisms, undergo random genetic mutations during replication. These mutations can sometimes confer resistance to antibiotics. If a bacterium with a resistance mutation survives exposure to an antibiotic, it can then multiply and pass on the resistance gene to its offspring. This process of natural selection is a fundamental driver of antibiotic resistance. The misuse and overuse of antibiotics accelerate the process of resistance development. When antibiotics are used inappropriately, such as for viral infections or in unnecessarily high doses, they create a selective pressure that favors the survival of resistant bacteria. Several factors contribute to the misuse and overuse of antibiotics. Overprescribing by healthcare professionals. Antibiotics are often prescribed for conditions that do not require them, such as viral infections. Patient demand for antibiotics. Patients often pressure doctors for antibiotics, even when they are not necessary. Lack of access to diagnostics. In many parts of the world, access to diagnostic testing is limited, leading to the inappropriate use of antibiotics. Agricultural use. The widespread use of antibiotics in livestock and agriculture is a major contributor to AMR. Section 6. Recognizing the enemy. Symptoms of superbug infections. Superbug infections can manifest in various ways, depending on the type of microbe involved and the site of infection. Recognizing the signs and symptoms of these infections is crucial for seeking prompt medical attention and receiving appropriate treatment. Common symptoms of superbug infections include fever and chills, a common sign of infection, indicating the body's immune response is fighting off the invading microbe, fatigue and weakness. The body diverts energy to fight the infection, leading to feelings of tiredness and lack of energy, pain and swelling. Inflammation at the site of infection can cause pain, redness, and swelling. Persistent cough or difficulty breathing. These symptoms may indicate a respiratory infection such as pneumonia. Gastrointestinal issues, nausea, vomiting, diarrhea, and abdominal pain can be signs of a gastrointestinal infection. Skin infections. Redness, swelling, warmth, pus, and pain are common signs of skin infections. It is important to note that these symptoms can also be associated with other conditions. If you experience any of these symptoms, it is essential to consult a healthcare professional for proper diagnosis and treatment. Early detection and appropriate treatment are crucial for improving outcomes and preventing the spread of superbugs. Section 7. Prevention is key combating AMR through responsible practices. Preventing the emergence and spread of antimicrobial resistance requires a multifaceted approach involving healthcare professionals, patients, policymakers, and the agricultural industry. By adopting responsible practices, we can preserve the effectiveness of existing antibiotics and mitigate the threat of superbugs. Key prevention measures include responsible antibiotic use. Antibiotics should only be used when prescribed by a healthcare professional and should be taken exactly as directed. Completing the full course of antibiotics, even if you start feeling better, is crucial for killing all the bacteria and preventing the emergence of resistance. Improved hygiene practices. Simple hygiene measures, such as frequent hand washing with soap and water, can significantly reduce the spread of infections. Covering coughs and sneezes and properly cleaning and disinfecting surfaces can also help prevent the transmission of microbes. Vaccines are one of the most effective ways to prevent infections and reduce the need for antibiotics. Staying up to date on recommended vaccinations can help protect individuals and communities from vaccine-preventable diseases. Reducing agricultural use of antibiotics. The widespread use of antibiotics in livestock and agriculture is a major contributor to AMR. Implementing policies to restrict the use of antibiotics in animals and promoting alternative approaches to disease prevention in agriculture are crucial for addressing this issue. By embracing these preventive measures, we can collectively contribute to the fight against antimicrobial resistance and safeguard the effectiveness of these life-saving drugs for future generations. Section 8. Fighting back treatment options for superbug infections. Treating superbug infections poses a significant challenge due to their resistance to multiple antibiotics. Treatment options often involve a combination of approaches tailored to the specific type of infection and the patient's individual circumstances. When a superbug infection is suspected, healthcare professionals typically perform laboratory tests to identify the specific microbe involved and determine its susceptibility to different antibiotics. This information guides the selection of the most appropriate treatment regimen. In some cases, effective antibiotics may still be available to treat the infection. However, these antibiotics may be more toxic or have more side effects than those typically used for susceptible infections. Careful monitoring and management of potential side effects are crucial during treatment. For infections resistant to multiple antibiotics, alternative treatment options may be considered. These include combination therapy, using 2 or more antibiotics simultaneously to overcome resistance mechanisms. Phage therapy, utilizing viruses that specifically target and kill bacteria. Monoclonal antibodies, administering laboratory-made proteins that bind to and neutralize specific pathogens. Supportive care, providing supportive measures such as intravenous fluids, oxygen therapy, and pain management to help the body fight the infection and manage symptoms. The choice of treatment depends on various factors, including the severity of the infection, the patient's overall health, and the availability of treatment options. Prompt medical attention and appropriate treatment are essential for improving outcomes and preventing the spread of superbugs. Section 9. A global call to action, collaborative efforts to combat AMR. The fight against antimicrobial resistance is a global challenge that demands a coordinated and collaborative response. No single country, organization, or sector can address this threat alone. International cooperation, innovation, and investment are essential for tackling this growing crisis. Several global initiatives are working towards combating AMR. World Health Organization, WHO, Global Action Plan on Antimicrobial Resistance. This plan provides a framework for countries to develop and implement national action plans to tackle AMR. Tripartite Collaboration on Antimicrobial Resistance, a joint effort between the WHO, the Food and Agriculture Organization of the United Nations, FAO, and the World Organization for Animal Health, OIE, to address AMR across human, animal, and environmental health sectors. Global Antimicrobial Resistance Research and Development Hub, a collaboration between several countries to accelerate the development of new antibiotics, vaccines, and diagnostics. These initiatives highlight the importance of a One Health approach to tackling AMR, recognizing the interconnectedness of human, animal, and environmental health. By working together, we can slow the spread of superbugs, preserve the effectiveness of existing antibiotics, and protect global health. Combating AMR requires sustained commitment and investment from governments, healthcare providers, researchers, the pharmaceutical industry, and the public. By prioritizing research, innovation, and responsible practices, we can prevent this silent pandemic from becoming a catastrophic reality.